you very much, Claire, and thank you so much. It's fantastic to see some familiar faces and some new faces, and just really want to welcome you to the meeting. And we're so glad you're here, and it's your input really matters. And so thanks for taking the time. I'm really delighted that you're interested to be involved. And so please just feel comfortable. It's an informal meeting. Every opinion matters, and we really care about what you've got to say. It's always so much value to us, so thank you. So I'm just going to give a quick roundup of what we've been up to. I just pick out a couple of the things that I think are really important to the patients and patient organisations. But we've got a newsletter, so if there's anything that you'd like more information on that I mentioned, it's in our newsletter, and you can sign up for that on our website. And that also gives all the details of each medicine that's been approved, and more detail about the things I'll discuss. So if there's anything that you I mentioned and you'd like more information, it's all on the website and in our last winter newsletter. And it always amazes me when I do these roundups how much we've been up to. So one of the things really exciting, I think, for us is that we've secured a significant amount of new funding. And really what we're going to be doing with that is looking at how we get medicines to patients quicker. So some of the things that we're going to spend that money on is horizon scanning. So we're looking to the future of what medicines are coming out, and we really want to make sure that everything's in place, so that one of the things we want to do is make medicines available as quickly as possible. And sometimes with some of the newer medicines, there's different tests and different things that need to be set up, and there's lots of changes happening with medicine. So some of that money we're going to be really looking at making sure we look ahead and see what needs to be set up. So we're going to spend some money on that, and also looking at using that money to capture data. So we really want to make sure our medicine's being used in the same way, our people having access throughout Wales, and just looking at sort of data which helps us to make sure that patients are accessing medicines in the same way across Wales, and that people are using medicines in the way that they should. So new medicines are being used, and patients are getting access to them. So that's really exciting. We're going to have a lot of new posts and a lot of new people in place to really help us look at how we access medicines in Wales. So excited for that, and we'll keep you updated. Some of the other things that we've done is we've launched a hub of information about sodium valproate. So this is a drug that's used in epilepsy, also in bipolar, but there are issues in its use in pregnancy. So there's a whole host of information on that, if that's of any relevance to anybody. But that's the sort of information we try to do, where we know that there's a medicine potentially where we need a bit more information. So there's information for patients, for prescribers, lots and lots of information on there on sodium valproate. So as any of you may have been involved with this before, medicine safety is a huge important part of what we do, and avoiding harm. So we've had a medicine safety week, and we really look at the reporting of adverse drug reactions provides such useful information into the harm that's been caused, and allows really important information. So we've had medicine safety week, and the yellow card team who've talked at PAPIG quite a few times have been out and about really promoting yellow cards, and I'm always proud to say that we really lead the way in Wales. Our yellow card reporting is the highest of all the nations. So we're doing well on that, but really important that we keep looking at those adverse drug reactions and reporting them. We've also had some national initiatives. So this is just to share with you that as well as working in Wales, we also work with the other 4 nations. And there's 2 things that particularly we're working on. One is medicines, looking at medicines and medicines devices, that all 4 nations work together to ensure really that we're improving access for patients. So that's a group where the 4 nations will work together. And then also something I think that's really exciting is a new group has been launched, which again will be the 4 nations. And this is where we're looking at medicines which actually are really transformative, where there's something completely different, where they're really going to do something that other medicines haven't done, or there's a real need for a new medicine. And what they're looking to do is to get this available quicker, because the problem is sometimes medicines take a long time to go through the process. So this is an initiative where all of the 4 nations work together, and they identify these medicines where actually we really need to get them through quicker. And we're looking at getting these to patients in the shortest time available, so that instead of them going through the normal process, we always almost identify there's a real need, these are transformative, and we want to get them to patients in the fastest time available. So that's called ILAP, which is Integrated Innovation, Licensing and Access Pathway. So it's really just getting it through the process of getting a license quicker so patients can have that. So that's a really exciting thing. And I think something that's will be really important, because when patients are waiting for these medicines, you know, it can take years and years for license to happen. So I think that will be really, really good for patients. Then we've produced a number of guidelines since our last meeting. I won't go into all of the detail, but just some of them that I've gone through is we produce prescribing indicators, and this is our way of really looking at improving practice. So our prescribing indicators for the next few years, that's been launched, and that's what we look at, how we measure prescribing with GPs and how we encourage them and we measure them. So we're looking at really encouraging better practice, and that's what we sort of choose in these indicators, and then we measure them across Wales. So we've launched that for the next couple of years. We've also launched an antibiotic guide, and this is about backup prescribing. So sometimes instead of doctors giving you a prescription right away to kind of cash in, they give you one to save for a couple of days. So actually, if things don't get worse, you don't have to use the antibiotics, and this really can help sort of preserve our antibiotics and not overuse them. So we produced a guide for that, which is lots of information for patients. It's got some patient information leaflets in there, and also some help about which patients are and aren't appropriate for that. We've looked at some prescribing dilemmas. One of the things we've looked at is how, in our recent update about, is managing how we manage when patients see somebody privately, and then how that comes back into the NHS and the GP, and how we manage that. So some of the things we also help out with are those sort of difficulties that we can help with decision making. And then for any smokers or people encouraging somebody to smoke, we've updated 2 of our smoking cessation guidelines and 1 on nicotine withdrawal in secondary care. So we've also appraised some medicines. The information of which medicines have been recommended are all on our website, rather than read out a list. And anything at all that you've more questions about, I'll be staying on throughout the call. So yeah, just raise any questions on anything I've mentioned, and thanks for attending.